Hey squad, welcome back to the channel. My name is Mike and today's video is the first of 3 in our look into heart failure. Heart failure is a chronic progressive disease in which the myocardium or heart muscle becomes weakened and cannot effectively maintain blood delivery to the organs and tissues of the body. Typically, you will hear heart failure referred to under the umbrella term congestive heart failure. Currently, there is no cure for heart failure other than a full heart transplant. However, those come with their own risks, complications, and really long wait times. We will cover the more commonly heard left and right side heart failure in 2 weeks. But first, we must discuss the differences between systolic and diastolic heart failure, starting with systolic failure. Systolic heart failure occurs when the heart cannot contract properly and maintain an adequate cardiac output. Remember, this is important, that cardiac output is equal to stroke volume times heart rate and is reliant on 3 factors. First, preload, or how much the blood returns to and fills the heart. Second, being contractility, or how strongly the heart can eject the blood from the heart. And lastly, the afterload, or the amount of pressure the heart must overcome to eject that blood into the aorta and surrounding vasculature. Afterload comes more into play when we speak about diastolic heart failure, so let's just pocket that for now and focus on contractility. If the contractility of the heart is weakened or lost, the myocardium loses the ability to squeeze the blood from each chamber, and ultimately the left ventricle loses the ability to expel blood to the body. The 2 main medical conditions that I want you guys to focus on are myocardial infarctions or heart attacks and dilated cardiomyopathy. When the heart infarcts due to prolonged hypoxia, it essentially dies. If enough myocardial tissue dies, the tissue loses the ability to stretch and contract effectively, lowering the amount of stroke volume it can eject per beat. A normal healthy adult heart should be able to eject anywhere from 50 to 80 milliliters of blood per heartbeat. Depending on the location of the infarct, it could limit the 50 to 80 milliliters of stroke volume ejected. Imagine an MI to the anterior or lateral wall. Heck, you know what? Let's make this real festive and say it's an anterior-lateral infarct of the heart. These 2 walls combine for nearly 70% of the heart's pumping function. The heart is still able to fill, but cannot contract effectively to maintain adequate perfusion to the tissues of the body. Now, still looking at systolic heart failure, let's talk about preload. If the heart is normal and not sick, having a decreased or increased preload should be manageable. But what happens if the heart has a decrease in contractility and we increase the preload? The heart can hold approximately 280 milliliters of blood if fully filled. This is the total preload available, each chamber holding approximately 70 milliliters of blood. Now let's say the ventricles are weakened and cannot contract normally. Each beat, instead of ejecting the normal 140 milliliters of blood, it only ejects 30 milliliters, leaving 110 milliliters within the myocardium. Then, during diastole, the heart fills again. However, because there's already 110 milliliters of blood sitting in the heart, the myocardium stretches and fills to, say, 160 milliliters. But then again, during contraction, still only generates 30 milliliters ejection fraction. Now there is 130 milliliters sitting in the heart, waiting for diastole to occur once again. The longer this occurs, the more the heart fills with blood and the less it can perfuse out to the tissues. Valve conditions like mitral and aortic regurgitation can be a cause to increase preload in a sick heart. Valves have literally one job: to keep blood moving forward. If they become weak or damage themselves, they can allow a backwashing of blood, which could trap blood within the heart, increasing preload. Dilated cardiomyopathy can be caused by prolonged hypertension, myocardial infarction, hepatitis, HIV, and, among others, coronary artery disease. This is a condition of the myocardium where the chamber wall stretches and ultimately thins the myocardium itself. The overstretched chamber and thin myocardial wall decreases the strength of contractions and the ability for the heart to effectively pump blood. The left ventricle is statistically the first to see a change in size. Well guys, that's it for today's video. As always, stay safe out there and I will see you in the next video.